Florida Central. Estamos listos para comenzar con ¿Cómo se dice? Este programa es presentado gracias a los siguientes auspiciadores. Orlando Chiropractors, 2 oficinas quiroprácticas convenientemente ubicadas, con citas disponibles para el mismo día. Llame hoy para la suya al 407-275-3551. Gulf Coast Imports, las mejores marcas de productos de belleza, salud y limpieza sin tener que salir de su hogar. Para más información, llame al 407-760-5260. Alisa International, traducciones certificadas para todo uso, prontitud, exactitud, asequibilidad y conveniencia. 407-381-2962. Y bien, en un ratito les voy a decir ¿cuál es el país al cual vamos a dedicar el programa? No se los voy a decir todavía. Vamos a ver quiénes lo adivinan, quiénes me pueden poner cuál es el país, aunque lo más seguro es que allá arriba vieron cuál era, pero no se los voy a decir verbalmente en estos momentos. Sin embargo, vamos a seguir con el transcurso del programa como siempre y mantener eso en misterio. Tenemos varias sorpresas para el día de hoy. Y entre ellas está, una vez más recordarles, aunque ya eso no es tan sorpresa, vamos a recordarles que Unidos por Ecuador es una agencia sin fines de lucro en el estado de la Florida. Como tal, presta una amplia gama de servicios a toda nuestra comunidad en la Florida Central. No solamente personas provenientes del Ecuador, sino a todos aquel que lo necesite, como van a ver en el anuncio de Access, que es el Departamento de Niños y Familias de la Florida, la división específica que se encarga de aprobar concesiones de estampillas y demás, y eso lo van a ver en los anuncios. Así que vamos a pasar ahora con los anuncios y regresamos. El que es generoso prospera. El que reanima será reanimado. Permítanos compartir nuestra bendición con ustedes. Queremos recordarles que los viernes entre 6 a 9 de la noche, Einstein Bagel Brothers se ha ofrecido a proveernos artículos de repostería y postres que tenemos a la disposición de todos ustedes. No necesitan darnos número de teléfono, no necesitan darnos su nombre, no necesitan cumplir con ningún requisito. Simplemente llámenos al 951-5184 para que estemos preparados para recibirle. Unidos por Ecuador, haciendo la diferencia. Porque Dios bendice al dador alegre. Ahora Panera Bread también nos va a estar ayudando a satisfacer las necesidades de nuestra comunidad. Panera, conocida por sus deliciosos panes, postres y cafés, va a estarle ofreciendo a Unidos por Ecuador los lunes la oportunidad de tener artículos de repostería y postres para todos ustedes, recogerlos en nuestras oficinas de 10 de la mañana a 5 de la tarde. Las oficinas de Unidos por Ecuador están ubicadas en el 1015 State Road 436 en Castleberry, Florida. El número de la suite es la 241. Para más información, llame primero al 407-951-5184. Unidos por Ecuador, haciendo la diferencia. Hermanos latinoamericanos, ahora estamos listos para ayudarle con más servicios. Unidos por Ecuador y el Departamento de Familia, junto con el programa Access,
se han unido para ayudarle a usted a solicitar diferentes servicios. Podemos ayudarle a solicitar cupones para alimentos, dinero para casos de emergencia y el programa de Medicaid, que es el seguro de salud del gobierno del estado de la Florida. Para esto usted deberá llamarnos al 407-951-5184, ya que solamente atendemos para esto los martes y los jueves durante horas laborables. Unidos por Ecuador, haciendo la diferencia. ¿Necesita ayuda con la preparación de impuestos? Llámenos. Unidos por Ecuador of Central Florida está certificado por el mismo IRS para ayudarle a preparar y a radicar sus impuestos. 407-951-5184.
Y bien, ahora voy a pasar, todavía no les voy a estar diciendo cuál es el país que está de invitado, el país al cual vamos a visitar en el día de hoy. Simplemente ahora vamos a pasar con los regionalismos y que los disfruten y a ver quiénes adivinaron qué país es el escogido para el día de hoy. Y regresamos en un ratito.
En el día de hoy presentamos los regionalismos de Perú. Regionalismo es una palabra o una forma de hablar en diferentes países. Eso significa que una palabra puede significar algo en un país y en otro país diferente puede tener otro significado o tener varios significados. Calapata. Estar calapata es estar descalzo. ¿Y qué son marrocas? Marrocas son esposas. Estuvo muy tranquilo hasta que no le pusieron las marrocas. Chuma. Cuando algo está chuma, está desabrido o soso. ¿Y qué es un jailoso? En Perú, alguien que es un jailoso es un creído. ¿Y qué es apolillar? Parece que apolillar viene de polilla porque significa dormir. Cuando dicen ese tipo es un careta, ¿qué quieren decir? Alguien que es un careta es un desfachatado o un carifresco en Puerto Rico. ¿Y qué será un merengue? En el Perú, un merengue es un enredo o un lío. Y cuando alguien se aparece con una botánica, ¿con qué se habrán aparecido? Una botánica usualmente es una botella de licor. Y ahora ya saben, en Perú, ¿cómo se dice?
Dr. Preziosi, how you doing?
Lisa, hello. It's always great seeing you. I'm sorry that we have to wear these masks under the circumstances. Of course, everybody understands. But it's always my pleasure for you to come and do my interview with me. We have a great time.
Thank you.
So
Thank
you have a lot
you.
of good questions today, right?
Oh, I'm gonna drive you insane. I'm gonna drive you insane because
Do it.
you know that a couple of days before I start preparing and I start thinking, what else can I ask? Of course, that no one else asks.
Correct. It's not easy, but I'm sure you'll have a couple.
Sure. Doctor,
Yes.
we do know that you treat personal injury cases of workers' comp, and other auto accidents.
Correction, we specialize in auto accidents, but as you said, we do treat many other different cases, a lot of health insurance, Blue Cross, Aetna, the different gamut out there, United Healthcare. So in addition to the auto accidents that we spend a lot of time on, most of our patients, we do treat workman's comp, auto, cash, Medicaid, not Medicare, but Medicaid, and things like that. So we're pretty busy here, but thank goodness.
Excellent, yes. And I didn't mention it in English, but basically Dr. Preziosi has 2 offices. This one, for the first time I'm here, is located on 823 Paul Street in Orlando, Florida. That's on the west side of Orlando.
Correct.
And then there's the other one located on 7206 Curry Ford Road.
That's correct.
And that one is what they call East Orlando.
Right.
So both offices are very quaint, they feel very cozy, they feel very personal,
Good.
very
Good.
personable. And I'm dying to, in fact, we're gonna do, next month what we're gonna do is I'm gonna come in, quote unquote, for treatment,
Okay.
and we're gonna show the office
Okay.
around.
We'll do a little tour, absolutely.
We'll do a little tour if it isn't that I actually come in for treatment and we tape some stuff.
Now that you know where the office is, you won't have trouble getting here on time, right?
Not at all. I got here on
She
time.
got here on
that's not
time,
even-
I'm sorry. She got here again on time, there you go.
I got to the other place first, and I was just totally wrong.
My fault.
Your fault. Anyway, doctor,
Yes.
we know, of course, of all types of accidents, but we've been at home. People like me have been at home for about 6 months or so,
Right,
developing all kinds of bad habits.
yes.
Right now I'm sitting very straight, but if the camera weren't on, I'd be like this.
You look amazing. Look at this posture. Sit up. Come on forward.
You know, it looks better on camera. So anyway, so we've developed conditions, and we can talk about that a little before we go into conditions that are just non-accident related.
Right.
So doctor, basically you're still seeing a lot of cases of people who are doing things wrong at home while they're working?
I am. It definitely has increased, and we touched on this a little bit several weeks ago. We
Yes.
talked about it, but the lack of activity, I can't emphasize that enough. People are sedentary. They're not exercising as much, not moving as much, and of course the pandemic, COVID virus, has created this lack of activity. You're not going to the store, you're not going shopping, you're not visiting family, so you're sitting a lot at the computer, you're sitting on your phone, you're watching TV more. Your muscles and ligaments in your spine, they want to be moved. You know the expression, if you don't use it, you lose it.
Yes.
So if you're not lifting, bending, pushing, moving, getting up and walking around at home, there's plenty of exercises you can do, even if sitting, if you're at a computer for a long period of time. But I always emphasize with my sedentary patients that are working from home, especially, get up and move around. Every 15 or so minutes, get up, do a little bit of stretching. I'm talking about 20, 30 seconds. Every 15 or 30 minutes, break that cycle. Because by the time the end of the day, if you're not moving around, the damage is already done. It's too late.
Yeah.
So, yes, muscle spasm from being in the same position for too long on your computer or on your phone or watching TV creates a lot of spasm, lack of flexibility in the spine, and that results in stiffness and, of course, pain. You can also get referred headaches coming from the neck. If you've got a lot of extra tension in the neck, it's going to give you a headache. So if you're not keeping your neck flexible, sleeping in the right position, exercising, muscle contraction type headaches are very, very common. Sitting too much. When you're sitting on the sciatic nerve. We've all probably, most of us have heard of the sciatic nerve or sciatic type pain, people that have radiating pain or numbness down their legs. So when you're sitting, you're literally sitting on that nerve. It's the biggest nerve in the body. The diameter is about the diameter of a thumb, so it's very big and easily compressed and easily irritated. So you don't want to be sitting too much because eventually you're going to have leg pain or numbness associated with that sciatic nerve being under pressure for too much. So those are just a few things, other than possible carpal tunnel, from doing too much typing and keeping your wrists in the flexion forward position too much. Of course, the neck strain that we talked about from being bent forward or looking in the same position for too long. So again, move as much as you can based on the circumstances. I know you have to do your jobs, and at work a lot of people have done some change to that, but there's no reason why you cannot get up every 30 minutes, move around, do 10, 15, 20 seconds of stretching.
And even reach out for that very important glass of water that you also need.
Stay hydrated, yes. Extremely important to stay hydrated. 80% of your body mass is water, so you must continue to replenish that water. You're sweating even when you don't even know that. You're urinating, so you're losing fluids all the time. And it's funny, just if I can step back for a second, many headaches, besides coming from tension in the neck, also come from being dehydrated. A lot of people don't know that. Your brain needs that water to function properly. So what is the right amount of water? Most studies have shown 5 to 8 glasses of water a day. That's a good range, and more is fine, less is not good. And I'm not talking about coffee, tea, I'm talking about water, because the tea and the coffee have caffeine, and they dehydrate you, meaning they make you go to the bathroom more and lose the fluids even quicker and more often, or more greater amount.
Yes.
So hydrating is very important, and for your muscles, ligaments, your cells, your brain. Yep.
Moving. So basically, again, and I will mention it one more time before we actually get into the subject. You do specialize in auto accident injuries and
Yes.
treat workers' comp cases and personal injuries. But are there people, and do you have people, and maybe even a percentage, that actually have conditions that just have developed over time, or are actual illnesses or diseases that affect the body to where they've come to you for treatment?
Sure, just as an example, I was treating a stroke victim earlier today, and as you don't or do know, when you have a stroke, it affects your brain and it affects the muscle function and strength of your upper or lower extremities, or both. And so he was recovering, he's doing very well, and we're putting him through rehab. We're making sure his spine is flexible and in line. Because don't forget, all of your nervous system penetrates or radiates from the spine itself. So every muscle, ligament, and tissue and cell in your body gets its energy from the spinal cord, which is the center of the spine. And that's where we specialize in, making sure that you've got good flow of energy from your spine, meaning the nervous system. So you can have spinal pain, joint pain from arthritis, for example, whether it be from overuse, which is usually most common, that's osteoarthritis. So we can work on that with different therapies, laser and sound wave to get inflammation down. I treat a lot of patients that are born with scoliosis, which is a curvature of your spine. So when you look at your spine from the side, you want to see a curve. When you look at your spine from behind, your spine is supposed to be straight. So scoliosis simply means, and you're born with this, and it's a genetic thing. You either get it from your mom, your dad, or both. And there's different degrees of it, and to make a longer story short, because you have this abnormal curve in your spine, you're creating a lot of pressure in certain segments and certain areas of your spine that you would not normally have.
Yes.
So picture a straight, balanced spine compared to a spine with an S curve. So I treat many of those. I had 2 or 3 come in last week, matter of fact, and of course, we're not going to fix or cure the scoliosis. That's there to stay.
That was going to be my other question.
I know it was, and because we're connected. But we can do a lot to help relieve the pressure within the spine and any inflammation in the spine. Educate them on exercises to do on their own, which is really critical. What they do after they leave the office on an everyday basis is more important than what I do on a short-term treatment basis. So those are just 2 examples: arthritis, scoliosis. But understand, we're musculoskeletal spinal specialists. So whether you slip at home, you lift something at work and strain your back, or you're in an auto accident and you create a whiplash, it's still muscle, it's still ligament, it's still joint, and it's still a musculoskeletal injury. So our treatment, our therapies, our machines, our staff are trained to treat those, regardless of where the injury or the cause of the injury came from.
We talk, or I talk, about um, workers' comp, when I mention your areas of specialty, I talk about workers' comp, and I tie it into what are we doing at home, but I've never talked about or never brought to you the concern. Are there things at home, regular household chores that can actually give you some kind of injury?
Well, I mean, if you're bending and mopping, that's a very common, or vacuuming, so your motion is rotating and it's repetitive. I've seen that create a lower back strain. Even a golfer, you can be out there golfing and do too hard of a swing, and that rotating of your mid to lower back and create a very bad lower back strain. So mopping, cleaning, repetitive bending, you know what it is when you're cleaning? If you're cleaning the bathroom, you're cleaning the toilet, for example, or you're standing at the sink doing the dishes, you're leaning over. So anything that's going to create strain in an abnormal way to your spine, whether it be rotating with the mopping or sweeping or vacuuming, or leaning over and cleaning the sink or the toilet or the bathtub, and you're not changing position, you're not watching the way you're leaning over and bending, that can create strain to the muscle ligament and create a muscle spasm or inflammation.
Would a rule of thumb such as if it feels uncomfortable, you just shouldn't continue doing it?
It's a good point. Yeah, I mean, listen to your body. If you're leaning over and you're getting a burning sensation, or you feel like your muscles are starting to tense up, that means the body's telling you you're in a wrong position, we need to change. So stand up gradually, change position, sit, take some deep breaths, and let those muscles go back to their normal level of contraction.
Yeah. Or execution, because I know, for example, when I do mop, I try to maintain my back straight.
Good.
But before, years ago, I was like all the way
now
down.
Now that you met me and I've treated you and
Yeah.
I've educated you, now you know you don't want to be bending over too long and putting that strain on your neck and back, of course.
Yeah, and things that are too heavy. Like the classical bucket of water.
Lift with your legs, lift with your arms, not your back. So you don't want to bend over and lift with your lower back muscles. You're going to strain them. Lift with your legs and your arms.
Yes. So now we go back into auto accidents.
Yes.
And again, both this office and of course our very dearest 34th location
That you went to?
that I went to and I was waiting outside. Basically, both locations have different modalities of treatment, and most of the professionals are bilingual, and the staff is completely bilingual.
The staff is completely bilingual, except one of the massage therapists. But she mentioned about the therapies and what I have at one office compared to the other. They are pretty much the same. The only thing I have at the other office that I don't have here is a decompression table.
Oh.
The mechanical, computerized traction machine. Everything else, the laser, the sound wave, the hydrobed, and things like that, I do have here.
Excellent. And basically, the staff rotates you from one to another. Sometimes the order can be a little altered depending on availability and depending on how many patients they have. And we're going to talk a little bit about the new normal for
Right.
the office practice.
But we are extremely flexible in terms of seeing. We'll see people the same day, almost always. I mean, if you need to be seen, when you have a back pain, you don't want to wait a day, 2, or a minute before getting in for treatment. So we see people the same day all the time.
Yes. And when I went, I didn't see it at this office because I didn't come in through the front door. But the other office has what the practice is going to be about. Like you ring the doorbell, you sanitize your hands, you go in, you sign up, you wash your hands again and sanitize.
Yeah, our protocol, if I can touch on that for
Yes.
a second, is extremely organized and I'm going to serious. We do the same thing at both offices. You do not enter the office until you're sanitized. Then we put gloves on you and we make sure you have a mask if you don't already have one. during the time there, if the gloves come off or the masks come off, we're pretty strict about everybody keeping their gloves and masks on, including myself and my staff. So you're protecting yourself and you're protecting the other people around you. So I think what I'm saying here is, it goes without saying that we are as careful as any office in making sure your safety is number one for you and for everybody else around you. And so be comfortable that if you do come to the office, everybody's going to be completely secure. We've been testing, everybody is negative, everybody's fine, and we welcome you. So we've been open since May of this year, and thank goodness we haven't had any issues.
Yeah, and thank God. And basically, because they have started again in May, they already have this down to a T. I mean, it is just as easy as that. Probably it's even just, you're just used to everything new that you have to do.
Yes, it's become very simple. It is an inconvenience. We're taking extra steps in sanitizing the rooms and the tables before in each patient, but like I said, the safety of the patients and the staff comes first.
Wonderful. So again, we're talking about auto accidents, injuries as a result of auto accidents, which we need to mention again. Remember, you have 14 days to be seen for the first time by a physician, either under your insurance company or of your choice, but you need to be seen
Hospital
for the first time. Yes, even at the hospital, you need to be seen, and it's good that you actually get seen, even if you don't feel anything, because we all know that you can walk perfectly out of an auto accident and 3 days later you can just like not be able to get up. I mean, it happened to me many years ago.
That's true. Yes, we can't emphasize that enough. It's a law that came into effect, unfortunately, but it limits you and forces you to be seen by a doctor, medical doctor, chiropractor, or hospital within 14 days of your injury. Otherwise, the insurance that you've been paying premiums on every month for years probably will not reimburse or pay for the services if you're not seen within 14 days. So,
or they have the right to refuse payment.
They have the right to
because
refuse payment,
some,
yes.
I actually have clients who are insurance company and they're like, listen, we really don't have to pay for it, but this person is in such bad shape that we're gonna give it, that chance.
Yeah, most, let's say 95% or more come in and they've been within 14 days, so there's not an issue. The ones that miss it, whether a day or a week, whatever, I would say 90% of the time the insurance company doesn't pay, and we have a little bit of a battle, Nice. So the insurance companies do not pay. They're not nice guys, they're not on your side, let me just say that.
Yeah.
That's a fact.
Yes. And then in terms of workers' comp, that's a little more open.
More complicated, actually. With workman's comp, we will contact the insurance company and get pre-authorization to treat you. So we'll have a conversation with the insurance adjuster on the case and explain to them what the injuries are, what kind of treatment plan we have, how often you're going to come in, how long you're going to come in, and what kind of treatment we're going to give. So we take care of that side. That's just communication with the insurance company. Workman's comp's a little bit more complicated than PI. We don't have to have that conversation with the insurance company for an auto accident compared to workman's comp.
Excellent. And again, his staff is one of the most professional, if not the most professional that I've ever seen. They take care of all this. You don't have to worry a thing. All you have to worry is about getting better.
Getting better, that's the main thing.
And following the doctor's instructions, which let's not even go into.
She's not a good patient.
No, and that's why I'm actually going to be coming back, doctor. That was another surprise I had for you.
Oh boy.
Yeah, because I've been slacking and I've been sedentary and so on and so forth. Everything hurts. So, on that note, doctor, what would you like to tell our people as a reminder?
Well, thank you for having me into your home. And Lisa, I appreciate you coming out, even though you had to go to 2 different offices to finally get here. We love you. Lisa's amazing. And I always enjoy coming on the show and educating the people. But a couple things, rest assured that if you do come here, it's extremely safe. We have an excellent protocol, and we keep it each and every day with every patient. So the chance of getting infected, if God forbid somebody was, is very negligible if it exists at all. Been practicing for 37 years, unbelievable, and
So he started as a baby.
I was 6 years old when I started, kidding of course, but plan on being here for many, many more years. As Lisa said, we have the 2 offices, east and west, 2.5 days a week at each office. Myself and my staff, we travel to each office. We do specialize in auto accidents, but that doesn't mean we don't treat all of the types of injuries. And if you've got general health insurance or your workman's comp, we'll be glad to see you. We're more than happy to. And it is important that you take care of yourself on your own. So regardless of having an injury and coming here, it's what you do every single day. Are you exercising? Are you stretching? Are you drinking enough water? Are you too sedentary? So you've got to take responsibility on your own to be more preventive. I'm talking about the simple strains, the neck pain, sleeping position. Just one thing that popped in my mind, sleeping position. Sleep on your back or your side. Never on your stomach, and not too big of a pillow, and not a flat pillow or no pillow. So that's just one thing I see creating a lot of problems. A mattress, if the mattress is too old and too soft, you're going to have back pain. And I cannot fix that. I can help you feel better, but I can't fix it until you change the mattress, or you change the cause of the problem, and that would be a mattress too soft. And I think Lisa looks like she has a mattress that's too soft. So we're going to raise some funds, and we're going to buy Lisa an extra.
I need more sponsors.
an extra firm mattress. But as always, thank you for having me into your audio, your homes. Thank you for having me.
I'm glad to be here. I always was curious about the other location that I hadn't been to yet, and today was the day. So I'm very happy. Thank you so much, Doctor.
Good to see you, elbow pump.
Elbow pump.
And I'll see you soon. We'll do this again,
Yes.
hopefully very soon.
Next month, we're actually going to do quote-unquote little bits of session.
We're going to do a tour.
Yeah,
That'd be
and
great.
we're going to do the whole tour, and we're actually going to see. So if you have that fear that we have, and when I say we, I say our Hispanic friends. Basically, we prefer to just hang in there and suffer, and like you mentioned before, macho, and deal with the pain. But if we actually break that fear of, oh, come on, it's not that bad. Let me just go and take care of this so I can move on with my life. Move on physically. So basically, we're going to demystify a little bit what the different trends of, not trends, the different modalities of treatment are. So that's going to be our next project.
That'd be great, yeah. And one last thing. If you do come in for treatment, sometimes you've heard maybe the chiropractors treat too long and they keep you coming back. I've never practiced that philosophy. I can tell you that I will only treat you the minimum amount to get you stable, and then teach you things to get you the rest of the way in terms of healing and improving and following preventive measures down the road. So even if it's 2 visits and you're feeling great because you had a little bit of a stiff neck, you woke up, well, you slept wrong, you're out of the office, you're released. So it's not like, oh, I'm going to come to the chiropractor, I'm going to be seen for 3 weeks, 4 weeks, 6 weeks, no matter what the problem is. No, we treat the minimum amount in a minimum amount of time, save you your time, save you your energy, save you your money, and get you as well as quickly as possible.
Excellent. So that was it for today. We're going to continue with today's show. Así que regresamos en breve con cómo se dice.
Bye bye. See you next time. Hasta luego.
Hasta luego.
Este programa es presentado gracias a los siguientes auspiciadores. Orlando Chiropractors, 2 oficinas quiroprácticas convenientemente ubicadas, con citas disponibles para el mismo día. Llame hoy para la suya al 407-275-3551. Gulf Coast Imports, las mejores marcas de productos de belleza, salud y limpieza sin tener que salir de su hogar. Para más información, llame al 407-760-5260. Alisa International, traducciones certificadas para todo uso, prontitud, exactitud, asequibilidad y conveniencia. 407-381-2962.
Y estamos de regreso con cómo se dice. Yo quiero extenderles la invitación a que si ustedes saben de algún evento que se va a llevar a cabo o si ustedes están organizando un evento, llámenos al 407-371-7891 y déjennos saber para colocarlo aquí y anunciárselo a toda nuestra comunidad. Así que ya estamos en la parte final del programa. Yo les agradezco y para aquellos que están comunicándose hoy, poniéndose en contacto por primera vez, yo les agradezco que hayan pasado por aquí, que hayan visto de qué se trata y les invito a que me acompañen cuando visitemos a otro país latinoamericano, tal vez el que usted quiera, dígamelo aquí mismo. Así que regresaríamos para otra edición de ¿Cómo se dice?